Testing hypotheses and making inferences in biostatistics. Collecting and summarizing data is important. But the real goal of biostatistics is to answer bigger questions. Is there a real link between a risk factor and a disease? Does a new treatment work better than the old one? That's where hypothesis testing comes in. Here's how it works. First, asking the right questions. Researchers start with a specific hypothesis, a guess about how two things might be connected. Second, comparing groups. We might compare outcomes between people who are exposed to something and those who aren't, or between patients who get different treatments. Third, choosing the right statistical tests. The test we pick depends on the data. Comparing averages? We might use a t-test. Looking at risk factors? We might calculate relative risks or odds ratios. Tracking time to event outcomes, like survival after a diagnosis? We use survival analysis. Sometimes we start with a crude analysis, a simple comparison. But often, we move to adjusted analyses, where we control for other factors that could affect the results, like age, gender, or lifestyle. Adjusting helps make sure we're seeing a real effect, not just a coincidence. Handling real-world challenges. Data isn't always perfect. We have to handle missing information, check for biases, and account for things like censored data when people drop out of studies. The big picture. Hypothesis testing isn't just about finding a difference. It's about proving that difference matters and that it's not just due to random chance. It's how biostatisticians move from data to discovery, building the evidence that drives better treatments, smarter policies, and healthier communities.